Yo, family, what's up? Welcome to another edition of Conversations with Them Two, the Shenanigan crew. I'm one half of the dynamic duo. I'm your host for the evening, well, part of the evening. I'm MJ Smith, and she is.
I'm Lady Des, and we're so glad that you all are tuned in tonight because we have a very important conversation. We're talking about sickle cell trait and the sickle cell disease on tonight, a condition that affects thousands in our community, the Black and Brown community, the minority community, and often doesn't get the spotlight it deserves.
Absolutely. And, Lady Des, we're honored tonight to so have with us a very, very special guest, the president of ASAP, which stands for Advanced Sickle Cell Advocacy Project. Her name is Miss Kemba, and she's going to share all of the wealth of knowledge that she has, as well as resources, and how ASAP's leading the charge in educating our community. So, Kimba, let's start from the basics for those who may not know. Can you explain the difference between sickle cell trait and the actual disease of sickle cell?
Hi, and thank you so much for inviting me to share. I'm very grateful for the opportunity. Sickle cell trait, you have to be a carrier to have the trait. Okay, I'm a carrier of the trait. I didn't know anything about sickle cell disease. Let me just say that until my daughter was actually born with actual sickle cell disease. So the trait means you carry the gene. You don't actually have sickle cell disease, and sickle cell disease is the actual disease, which is an inherited blood disorder. And a lot of people don't know that it's the most common inherited blood disorder in the United States. So, and
Wow.
1 in 13 of us, Black Americans, African Americans, are walking around with the sickle cell trait and not even aware of it. Like I said, I was a person with the trait and was not aware until actually I had my daughter.
Well, let me ask you this. What are some of the signs and symptoms should we be aware of, and how early can this condition be detected?
Well, here in Florida now, the newborn screening program tests all newborns regardless of the race. So if a child is born now, you will know if your child carries the trait. And also when you're pregnant now, they screen you as well. So in terms of, I'm sorry, what was your question again?
No, I was saying, like, what are some of the signs
Oh,
and symptoms, and
yes.
how early can it be detected? But you pretty much answered the last question first. That's what you did.
Okay. So as the picture that you have with the flyer, when you think of
Mhm.
a red blood cells, they're round, right? Plump, round. So we are our cells are round and normal. So someone with sickle cell disease, they have red blood cells that are shaped like a sickle, a half moon or a banana. So
Mm.
you can imagine when you have something round and smooth as it flows without a problem. So when you have that sickle shape that's shaped like a half moon or a banana, it's gonna get stuck. And that's what happens. It can get stuck anywhere in your body, any organ in your body where blood flows. There's a lack of oxygen. So what happens is when that happens, it causes excruciating pain. Pain that me having two children, cannot even compare to the pain that someone with sickle cell has to endure. From me being a mom and a caregiver, looking on the outside, not only with my own daughter, but with other people that have sickle cell disease, the pain is far more greater than that, and it leads to organ damage. Uh, it leads to bone loss as well. My daughter lost her hip at age 11 due to something called avascular necrosis, where she suffered bone loss due to the lack of oxygen due to the sickle cell. So it's very excruciating pain. I have lost several people to sickle cell disease, more than I care to count. So it's a very, very, very serious condition that even today, even though it was the first documented inherited disorder in the United States, it's 2025 and we still are lacking in a lot of areas. We are making progress in terms of research, but in terms of the treatment that people with sickle cell face, we still have a long way to go. Pain, jaundice in the eyes as well. You may see some sickle cell warriors with yellow eyes um, as well. But pain is the hallmark of the disease, and it's what's causing that pain. Something is breaking down is what's causing it.
Now, Kimba, let me ask you this: how common is sickle cell in the African American community, and how does that compare to other ethnic groups?
Well, a lot of people think that is definitely disproportionately affects us. However, it's not. A lot of people sometimes think that it's a black disease, which it does affect people in the Mediterranean, Hispanic. We have a high Hispanic population with sickle cell disease. South Asia, Middle Eastern, Mediterranean descent also um, is impacted by sickle cell disease as well.
Can you hear you, Des? You're muted.
I'm muted.
No, no, not you, Des.
Oh,
Thank you. I apologize. What does it mean to carry the trait versus having the actual disease?
well, sickle cell is not contagious. You have to be born with this. I was born with the sickle cell trait, so that means I carry the gene for sickle cell. It won't develop into sickle cell disease, but I'm a carrier. If you have the actual disease, then you have, the actual disease. And there's a
Okay,
blood test that you get called hemoglobin electrophoresis to determine if you have that makes the difference between actual sickle cell disease and sickle cell trait.
so the only way you can get the sickle cell disease, you have to be born with it because it's an inherited blood disease, correct?
Correct. Like I'm a carrier of the trait, and my daughter's father is also a carrier of the trait. So when two people with the sickle cell trait um, come together and have a child, they have a 25% chance with each pregnancy that your child can have the actual disease, a 1 in 4 chance.
Wow. Wow.
So
Go ahead.
with that being said, Kimba, let's talk about some of the misconceptions or the myths that you can clear up regarding sickle cell.
Well, one is that it's the black disease. It only affects black people.
Hmm.
The other myth, which I don't even, is very hurtful, is that people with sickle cell just want pain medication and they're drug seeking. That is a serious problem that we have within the community, where because pain is a serious complication of this condition. So
Right.
when a lot of times when people present, adults present to the emergency room, they're in excruciating pain. And because they are of color, a lot of times they get stereotyped that, okay, they just are here for the drugs. So that is a very, very serious misconception that people with sickle cell are just drug seeking. Um, Sickle cell people are slow. I've heard that the brain that they can be slow. That is definitely a terrible misconception, because people with sickle cell are some of the most strong, resilient people that you ever want to meet, and most intelligent as well, because they have to endure so much from a young age. By the time my daughter was, I would say, in elementary school, she had already been in the hospital over 30 times.
Wow.
And they have to endure so much at a young age. And that's why they're called warriors, because they exhibit amount of strength that you can't even imagine. Like the strongest man couldn't even endure some of the things that I've seen my daughter and other sickle cell warriors go through. So those are some of the main myths that we have.
Okay. Des.
Kimber, let's just stay right there about the emotional side of things. Kimber, there's so many families living and dealing with this challenge of sickle cell daily. Can you share how this disease impacts individuals and families, not just physically, but emotionally and financially?
Well, I can tell you right off the bat, it affects you on every level: emotionally, mentally, spiritually, financially. Me, I have lost many jobs. I've even lost relationships with people because they couldn't understand, like, my daughter's going to come first, and she's an adult and she's still going to come first, and I'm still going to be there for her. So it affects you financially in terms of, many people with sickle cell, they find it difficult to maintain and keep employment. Like, my daughter's an adult now. She's never had a job. She's never worked a job. She has not been able to maintain employment like that. So many of them have to go on disability. And we have some warriors that are able to achieve and work and do things like that, but we have a lot that aren't able to. So when you have to miss so many days from work, um, a lot of jobs aren't sensitive to that. And me personally, I can talk from my own experience. I have lost several jobs behind me having to be in the hospital with my daughter. And it impacts the entire family. Everyone goes through this. I have a younger daughter who has at times she's felt neglected by me because I had to be in the hospital with her sister. Um, my daughter suffers from, I'm just going to be transparent and honest. I suffer from this too, PTSD, from having to be afraid of seeking care, because there are times when you may have to go to the hospital and you have to prepare yourself. My daughter and other people with sickle cell, they sometimes have to get dressed up to go to the hospital because they know they may have to present a certain way. If they go in there, that's something that me, being a healthy person, I have never felt like I have to get dressed to go to the hospital,
Wow.
to make myself look presentable so they won't think that I just want the medication, or like, I've never had to do that. Um, However, someone with sickle cell, that's a very real thing, that they feel like they have to get ready to go to the hospital so that they are not mistaken as someone just, wanting pain medication. So there's a lot of mistreatment. We have some wonderful doctors, do not get me wrong. We have some wonderful healthcare providers and we have some great nurses, but we still have a large amount that do not properly understand sickle cell disease and how to treat it. So therefore, that leads to a lot of mistrust, and it also leads to, like I said, the PTSD of not wanting to seek care because of how you may be treated.
Received. Yeah.
Now, speaking of being treated, Kimba, let's talk about treatment and management, if management is even a thing. What are some of the options available today compared to, say, 10 years ago?
Okay. Well, like I said earlier, sickle cell disease is the first documented blood disorder in the US, right? So you would
Hmm.
think over 100 years, first documented, we would have probably a cure by now, right? Like, you would think, okay, we have all of these medications. And to be honest, we don't have a lot of options still. We do have gene therapy, which is a blessing. We do have bone marrow transplant, these are curative treatments. But in terms of medication, we have hydroxyurea, we have Indari, and we have something called Advaccio. Now, we had one medication that was recently pulled from us. So we really don't have a whole lot of treatment options, but we have some trials that are going on. So we have treatment options that are being in a trial right now that are being developed. However, we still need more treatment options, because when you think of some illnesses, for example, like HIV, people are able to live longer. You don't hear about it being a death sentence, so to speak, and they have a lot of treatment options. But for sickle cell disease, we still don't have a lot of treatment options in terms of medication. So that's something that we really, 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 really need, because the bone marrow transplant, everyone may not be able to endure that. Also, gene therapy, that might not be an option for everyone, but we definitely need safe, effective treatment options.
Wow. Wow. Um, and it bothers me to hear that a lot of the patients have to dress up to go to the hospital. Let's talk a little bit about when a sickle cell patient goes through crisis. And I know you mentioned the pain. What does that look like? Or and let's go further. What does the everyday life of a sickle cell person look like when they're in crisis and also without the crisis happening?
Yeah, I would say, going off of my sickle cell warriors, including my daughter, they have a lot of chronic fatigue due to the anemia. Um, so the fatigue is can be very, very challenging. And like I said, we have some sickle cell warriors that are PhDs. So by no means am I saying if you have sickle cell disease, you cannot achieve. And so it may take a little bit longer, and that's okay, but you can still be very successful. And like I said, sickle cell warriors are very brilliant. However, this disease is not pretty. This is not um, something to be taken lightly. The pain and chronic fatigue alone is very, very much so overwhelming. And like I shared, at age 11, my daughter actually lost her hip due to, the bone loss. The sickle cell disease caused avascular necrosis, which pretty much deteriorated her entire hip bone. Her femur was completely gone. So she had to have a total hip replacement surgery at a very, very young age. Um, that's another complication that you can suffer. So I would say the chronic fatigue and the pain is a very, very serious challenge. And they can also get leg ulcers as well, ankle ulcerated ulcers on their ankles as well. That's another complication that you can develop. It affects, like I said, every part of your body, even the optic nerve. You know, um,
Wow.
retinopathy. You can get blindness. Um, we have several sickle cell warriors that have vision issues, so it can affect any part of your body where blood flows.
So, Kimba, you've mentioned the fatigue and it being difficult for your daughter to maintain a job or even seek employment. What did that look like when she was attempting to go to school?
Well, my daughter actually was on homebound schooling because, and sickle cell affects everyone differently. Um, Hemoglobin SS, which is considered to be the more severe form of sickle cell disease, that's what my daughter has, sickle cell SS. However, it was very difficult for her growing up. She actually had to do homeschooling from, I think she was in middle school. She had to go on homeschooling because she was just that sick. Every month or two, she was in the hospital for like a week. It was pretty bad. And back then, the bone marrow transplant, of course, gene therapy wasn't even on the table back then. But if someone had come to me at that time because my daughter was so sick, I would have jumped at the opportunity to have her undergo the bone marrow transplant because I would have been willing to take that risk because she was just that ill. It was very difficult for her to have a quality of life back then, plus her sister. They have the same dad, but my younger daughter has the trait. Again, that's the example of the 1 in 4 chance with each pregnancy. They have the same
Hmm.
father, but my younger daughter has the trait. The oldest one has the actual sickle cell SS disease. So she had to watch her sister do things that she couldn't necessarily do. So that was kind of difficult for her as well. Also for me as a mom watching that. Um, it was difficult to watch people engage in physical activities that she couldn't so much, that she couldn't do. But that is very, very hard. Um, that's very hard. So
I can imagine. I can imagine.
Yeah, yeah. And I can relate a little bit. I have a daughter that she doesn't have sickle cell, but she has epilepsy, and we had to actually take her out of school after middle school, and actually her beginning of high school she had to be taken out completely and had homebound school. So, for a child to grow up, going to school, being able to be sociable with her friends, hands on, that taken away, it did play a toll on
yeah,
everybody in the house. So I could just imagine what it was like just dealing with the sickle cell.
yeah.
Wow.
Because as a mom, as a parent, you want to make it better. You're supposed to be able to make it better. You're supposed to be able to be like, you know what, I'll kiss the boo boo, you're gonna be okay. But when you have a serious condition, epilepsy, sickle cell disease, you really can't make it better. You try your best to be there and be a comfort and stuff like that, but it's very difficult as a parent to me, it's no greater pain than to watch your child suffer. That's just, as a parent, like that's the worst. Um,
Let me ask you about this. How hard was it, or was it hard for you to get her benefits? Because that was an issue for us, and still is the issue for us.
yeah,
Just getting her disability um,
yes, that's a
was
big deal.
a difficult thing. Getting denied, and it was just hard for me because I'm like, me and her. We're both taxpayers here. She lives in our home, and she's not able to get, you know, the benefits that are out there. I mean, how difficult was that for you, or was it difficult at all?
Actually, yes, that's funny you brought that up because absolutely it was difficult. I actually had to get a disability attorney for my daughter. They actually were trying to pressure her, saying that she could work.
Yeah. Yeah.
So that most certainly is a challenge, and it was definitely a fight. And now with the new administration that we have right now, we don't know how things are gonna go. And because we have lost funding through the CDC, the NIH, for sickle
Yeah.
cell with disabilities. So it's very scary right now in this climate that we're in. But I did have to get a disability attorney for my daughter and fight for her benefits. I did have to do that.
Kimba, with this disease being, like you said, one of the very first known diseases to affect the blood and affect people, how have you seen an advancement when it comes to medical treatment or research in dealing with sickle cell to date? Have you seen any such advances?
Well, what I was saying earlier, the FDA has now approved the gene therapy for us, which we actually have. This is a segue into our support group. We actually have three support groups at ASAP. We have one for preteens and teens. We provide support services and we take it very seriously, providing support services for our families and individuals impacted by sickle cell. So we have three support groups. One is for preteens and teens, one is for adults, and then we have one for bone marrow and gene therapy recipients. Either they have undergone it, contemplating it, or they're currently going through it right now. So the FDA approved gene therapy for us, so which is very exciting. And these are curative treatments, the gene therapy and the bone marrow transplant. The bone marrow transplant, you have to have a match. You have to find a match. With the gene therapy, they use um, your own cells for that. So it's very promising on the horizon. Not on the horizon, it's actually happening right now. So that's very exciting and promising for us. So actually on September 20th, we have a member of our organizations who is one of the first ones in Florida to undergo the gene therapy. Um, he's going to be on our next support group on September 20th. So whoever's watching is interested in hearing about his journey and his experience, they can follow us on our social media. We'll be posting the flyers soon for that, but that's coming up next month. So September is Sickle Cell Month. So September is actually National Sickle Cell Awareness Month.
Absolutely.
Mhm.
Absolutely. I wanted to ask you this. You mentioned the bone marrow, and I know that we can donate it. How do we do that? How could the minority community or anyone go and donate bone marrow?
The National Donor Marrow Program, they used to be called Be the Match. They have a registry and they swab the inside of your mouth and they can determine, they put it in a database and see if you match with someone and that's in need of a bone marrow transplant. But you can go on that website, the National Donor Marrow Program. Like I said, they used to be called Be the Match. You can look them up, and if you're interested in doing joining that registry, that's you can do that, and that's very good. We also need people to donate blood as well. We have some sickle cell warriors that are on monthly blood transfusions.
Yeah.
They're required to get monthly blood transfusions, so it's always good to donate blood as well because the sickle cell community definitely needs blood. They call it
Family, if you're
extreme transfusions.
family, for those that are watching, you're tuned into conversations with them too, your boy MJ and Lady Des, and we are having a heart-to-heart conversation about sickle cell. So, just a disclaimer: we are not medical professionals. So, if you are experiencing anything or have any idea of going through something that has to do with sickle cell, we're encouraging you to go ahead and seek professional medical attention. That
Yeah.
way, if you know whatever your status is, then you know where you can go. But we are speaking to the president of Advanced Sickle Cell Advocacy Project, my friend, Miss Kemba. So, Kemba, with that being said, tell us a little bit about the vision of ASAP.
The vision is to change the narrative on how sickle cell warriors are viewed, to provide support services for them, and also to educate the community. We're very big on education. We have a partnership with Florida and International University, FIU, where we go in. We've been doing this since 2017, where we have panel workshops. We have one coming up on September 23rd, where we get in front of medical students, first and second year medical students that are actually in school right now, learning so that they can become future healthcare providers. And we have panel discussions with them and sickle cell warriors so that they can see warriors outside of the hospitals. Because unfortunately, a lot of times they get labeled as chronic complainers, this, that, and the other. So we put the warriors in front of these future providers so they can see the human side of someone living with sickle cell disease outside of them having a crisis. We also provide workshops throughout the community at community events, focus groups, health fairs, schools, churches, as well as nursing schools as well. We have a lot of collaborations that we do with our healthcare teams. Like I said, we have some good doctors on our team as well. We also work with our state representative, Felicia Robinson. We have been trying to get a bill passed, a continuing education mandatory course for healthcare providers, not just doctors, but anyone that has a healthcare license. HB 333, it didn't pass this legislative session. However, she will be filing it again. And what this bill does, it requires anyone in the state of Florida with a healthcare license to learn about sickle cell disease in order for them to renew their license. So that's one step. It won't fix all of our problems, but it's definitely a step to hold the providers accountable to learn about our condition. And it's very important that we get the support that we need. And again, they can follow us when we get ready to file that bill again, when she goes to Tallahassee and files that bill again. So we'll be asking for support because currently right now, if you have a healthcare license, it's mandatory for you to learn about medical errors, domestic violence, human trafficking. And Florida has the highest rate of people living with sickle cell disease in the nation. We're leading the nation with that. So you would think that with our numbers being so high, they would be eager to take the training. However, we have gotten a lot of pushback from healthcare providers not wanting this bill to pass because they don't want to be having more education on sickle cell. Not on education on sickle cell, but they don't want to have to take more training than they already have to. But what we're saying is we're suffering. It's important. It's affecting us at high numbers, and it's serious and it matters. And you should have to learn about it. So it's a step in the right direction in terms of better treatment. So that's something that we have been working on. We've been in the trenches doing the work for the last 10 years to make a difference.
And Kimbo, Lady Des and I were just at an event on last Saturday, and I'm frustrated because the to hear once again Florida or the Miami-Dade County area happens to be number one in something else again, which doesn't equate to anything that's good, but detrimental to people, and especially people that look like us. What can our viewers do to get involved, to volunteer, to donate, spread awareness? How can we do that?
Let me see if I can put, is the chat open? I'm going to put our social media and email in the chat. They can follow us there. We're always looking for volunteers. Like I said, you brought up the bone marrow. Look to see if you go ahead and join the registry. You can save someone's life. Donate blood as much as you can. That is a lifeline for people with sickle cell disease. I'm going to put the email in the chat as well. Get involved with your community-based organizations. Help us advocate. We're looking to go to Tallahassee next year again, and we want to have as many people on board as we can when this bill gets refiled. We need the support of the community. Not just, you don't have to say, okay, it's not in my family. I was at an event, the event that you guys were at as a vendor, and I promise I had like 7 people come to my table and say, I lost somebody to sickle cell. And it was very triggering for me because they didn't know that I'm there because I actually have a child with sickle cell, you know. Um, the amount of people, just 7 people saying I lost someone. And that is just so alarming to know how many people are truly impacted by sickle cell disease, but they don't just really talk about it enough.
Absolutely. And like I said at the beginning, it doesn't get the spotlight that it deserves. And a lot of times it's because it's in our community. It's in the minority that are really affected by this disease and by the trait. And you're right. And that was one of the things MJ and I spoke about as we were leaving the event on our way home. The amount of people that came to the tables taking advantage of the information, wanting to know more about whether it was sickle cell or the insurance, whatever was there. And we encourage everybody that is listening, that will listen, that go back and watch the replay of this, to take advantage. When you hear about these different events and community events that are going on, go out there, because there's always something that will benefit you, believe it or not. There are organizations that have a heap of information that they can give you, and people that you can network with to help you with a certain situation. It happened several times to myself, as well as MJ, and just seeing the community come out and go around the table, because we literally had to wait for you, Kemba, because you had so many people around you that wanted to talk to you and ask questions and see what you had to say, because they knew somebody that died or had a family member. So, I just thank you for taking the initiative to be there and to be a part, because we all are a community and we have to come together, unite, uh, just to educate and bring awareness in our communities.
Absolutely. Absolutely. I want to add to that. We also have a scholarship. The scholarship is the Kevin J. Francis Scholarship, and I'm super proud. We're super proud that 2024 we launched this scholarship. We gave 7 scholarships away, $1,000 scholarships to sickle cell warriors that are going to school. This year in June, we gave away 5 scholarships. This time was so special because we had 2 mothers that we gave scholarships to that have children with sickle cell disease. So our scholarship is not just for people with sickle cell, if you are a caregiver as well, because sometimes the caregivers get left out and they want to better themselves as well so they can be there for their child. So we're super, super proud that we were able to do that. And I want to add to about the sickle cell trait. It's important to know if you carry the trait, you need to get tested. Um, Also, if in the early 80s, it was made mandatory for Florida. So if you were born way before then, you wouldn't know, because it's not something that the children now are screened, the newborns now are screened for it. But you need to know not only if you want to have children, if you have the trait, but like I was sharing earlier, there's a rare form of kidney cancer called it's hard for me to pronounce it, renal medullary carcinoma. This type of kidney cancer disproportionately affects people with sickle cell trait. Not only that, the NCAA tests for sickle cell trait because they have lost athletes due to overexertion. So how hot it is outside right now, if you have the sickle cell trait, you need to be staying hydrated. That's something that we need to be educated on too. Because some people might be like, oh, well, I'm not planning to have kids, so I don't even know if I have the trait. You should still know, you still do need to know if you carry the sickle cell trait. And it's very important for people like us, people with the trait, to make sure they stay hydrated.
So, family, listen, if you want to support ASAP, the information is right there. Info at asapbeinformed.org. Kimba, if you would, is there a website or you want to give us your Facebook page?
Yes, that at ASAP Be Informed, that's the Instagram and Facebook pages that they can go on there. Do I need
Okay,
to put the
ASAP.
link or
No, ASAP Be Informed
yes,
on Instagram and on Facebook.
yes.
Kimba, would you like to give us any closing remarks?
I just want to say thank you again for the opportunity. This is my purpose in life. Is I used to question many nights, why did God give me a child with sickle cell disease? It's very hard, it's very difficult. However, at the same time, I know that this is my purpose and this is my calling. That He gave me this child with this so that I can be one of the ones to keep pushing, um, dispelling the myths, making things better, advocating on behalf of people with sickle cell disease. And so I accept that challenge. I no longer question why. I know that this is my purpose. I encourage everybody, follow us on social media. Please donate blood. Please get involved. Please advocate. You have a voice. We need your voice. We need more, more support. So
Wow.
find out your sickle status as well.
Awesome. Thank you so much, Kimba. This has been such an important conversation tonight. And I thank you for being so transparent, sharing your story, sharing information to edify and empower and build and just bring knowledge and education to our community. We definitely appreciate the work that your organization, ASAP, is doing in our community. So thank you.
Thank you. I appreciate the opportunity.
Absolutely, family. It's asapbeinformed.org. Check out the Facebook page, check out the Instagram, and most importantly, let's do our part. Let's get tested, let's get educated, and let's get involved because together we can make a difference in this fight against sickle cell. It is so, so important.
Amen. It
And don't
is.
forget, you can watch the replay of this episode on our YouTube channel, Conversations with Them Too. We just started our YouTube page. We want everybody to go to it and subscribe. And also right here on Facebook, it will be up for a while. So please watch the replay, share it with family members, friends, everybody, anybody you can think of, and please encourage people to give blood. Go and give blood, donate blood. Even you can donate bone marrow as well. So, Kimba, can you please give us that information on how they can look up if they want to donate blood marrow? I mean, I'm sorry, bone marrow.
Yes. They can go to, let me get the website. It used to be the Match. Now it is the National Dome Marrow Program. Let me see.
Because we want to just make sure that our listeners and the community actually get this information. Because we may have someone out there, closed mouths don't get fed. And she said it. We need the blood. We need bone marrow because there are a lot of sickle cell patients. South Florida, Miami-Dade County, we're at the highest in ratio for it. So please, we ask all of our listeners to help.
Definitely. It's NMDP. I'm trying to get their website so I could put it in the chat.
In the meantime, MJ, can you go? Are you seeing the comments?
Actually, I see this is Sophia Augustine. She says, it's very hard. Most likely, you have to get a lawyer if you want any type of assistance. Her mom had to get an attorney when she was 4 years old. Um, and she says she's so proud of you, Miss Kimba. Stephanie B, this battle is not yours alone. So thanks for sharing your testimony. Um, they're proud of you again, Miss Kimba. Um, Listen, this is a disease that once again affects us, and I'm just sick of South Florida being number one in everything that's bad. Let's turn this around. It's one of those things where South Florida doesn't have to be the butt of all jokes. We really don't.
Yeah.
Yes. And Sophia is actually a sickle cell warrior. So she's someone living with sickle cell disease. Hi, Sophia.
Well,
And Stephanie,
congratulations
are,
on being a warrior, Sophia.
Yes, yes. And keep fighting. Um, be strong, you know. And Stephanie B said it, the battle is not yours alone. You have people that are out here fighting, and definitely, Ms. Kimba, your passion exudes really. Even in this interview, we saw the passion when we were out there, and you was just sharing with everyone that came around to your table. So it takes special people like you to be a fight for those that really are not strong enough to fight for themselves. So, listen, all of you warriors out there, God bless you. May God give you strength. May He heal you, because I believe that God can do anything. And we just want to just love on you guys, and just let you know that we're praying for you.
Absolutely.
thank you.
So with that being said, also don't forget to get the book "You Are the Stage," written by Lady Des and myself, where we tell you, it's a map, a roadmap to success. I'm gonna say it, to success, and how to make sure that you always put your best foot forward. And not only that, this weekend we're going to be at the Urban Film Festival on Sunday. A on a faith panel talking about faith and branding. So definitely check our page and keep up with us because we're going to keep up with you. Ms. Kimba, thank you for the work you do. Sometimes being a caregiver, like you said earlier, you guys get overlooked. Thank you for being a warrior for those without voices or those that are too afraid to speak up. That website is my.nmdp.org. That's to find out more information about donating bone marrow.
Yes, definitely. And hi, Stephanie. That's our community outreach coordinator, nurse practitioner who runs our support group too. I had to shout her out.
Okay.
Beautiful. Thank you all so much for tuning in. And please remember to go to our YouTube channel. It's a brand new YouTube channel. Subscribe, like it, share it with others, because we have other conversations such as this and different things that are plaguing our community that we want to bring awareness to and educate our community, because our people perish for the
For
lack
lack
of
of
knowledge. So we
Absolutely.
want to bring education. We want to bring awareness, so we don't be blind of what's going on around us. Don't turn a deaf ear and think it's just going to go away. No, we need to be educated. We need to learn it. We need to learn
Absolutely.
it so we'll know what to do, in
Yes.
order to move forward and have a good quality of life.
Absolutely.
MJ, you can close
So
it out.
So, with that being said, family, it's conversations with them too. We do this each and every Monday night at 8:30 in the p.m. Once again, we want to say thank you to Miss Kimba from ASAP. Listen, family, tune in because you never know what you're going to get, but definitely be informed. ASAP, beinformed.org. Go and get all the information that we have there about sickle cell, the sickle cell trait. And once again, we're not medical professionals, so please seek a medical professional. If it runs in your family, get tested. Know your status again. Know your status. You're going to hear that a whole lot. Know your status. So with that being said, until next Monday, Kimber, thank you again. Lady Des, get off the stage.
I'm going. Good night,
Thank you. Have a
everybody.
blessed night. Thank you.
Thank you.